Hi ladies, it's Elisa and I'm here with another update about my IVF pregnancy that's been crazy. Thank you everyone for sticking with me throughout all of this craziness. And for all of my new subscribers, thank you for joining my journey here. Um, so crazy, right? um, Yeah, so where we left off was that baby Sawyer has completely defied all medical odds and pulled through this whatever was really affecting him. We're still really unsure. So I guess we'll just start picking up in the bump dates. They're not going to be on a regular schedule because the doctors are going to be monitoring me every 2 weeks. Those, I don't think they'll be on the same day every 2 weeks. And the, so it'll be in between weeks, like in between 21 and 22 weeks, was my last appointment. And my next appointment's going to be between my 23rd and 24th week. I mean, it's just going to be kind of crazy. So I'm trying to stick on a schedule, but I really don't think that that's going to happen. On top of the fact that I've just been so tired, but I'll talk about that later. When it comes to the symptoms. Right now, baby is the size of a papaya. Who eats papayas? I don't even know what a papaya really is. But then, according to the Bump app, that's how big he is. Between 10.5 inches and somewhere over 11.5 inches, and he's weighing just over a pound. And just developing and growing and putting on fat and stuff. He's doing really well. So where to start? Let's talk about me first, because who doesn't like talking about themselves? The symptoms that I've been having really, like I just mentioned, are exhaustion. I'm just tired. I think part of it was just this crazy emotional roller coaster that we've been on. He's healthy, he's not healthy, he could have downs, he doesn't have downs, he's dying, he's not dying. It makes me tired just thinking about all of the things we've gone through these last, not even these last few weeks, the whole pregnancy since 12 weeks. Just this crazy roller coaster. But last night, for example, I lay down at about 7:15 just really to just rest my back, get off my feet, elevate my feet. And then before I knew it, by 7:45 I was out, completely asleep. And the next thing I knew was 9:45, and I was woken up. I don't know what happened, but I woke up and was like, oh, well, I guess I'm sleeping now, so I'm just gonna brush my teeth. So I brushed my teeth and put on real pajamas and just got right back in bed and fell asleep for the rest of the night. Yeah. That's my life now. I saw this thing on Facebook and it said, one person says to another, you look tired, and the person responds, I'm pregnant, so I'm pretty sure this is just my face now. So ladies, this is just my face now. I'm just got a tired face all the time. Yeah, just tired. I have not thrown up since the day of the big ultrasound. So that's good. I'm not throwing up with brushing my teeth or anything. And I never threw up because of nausea really. But just getting better at harnessing my chi and making myself not throw up. Yeah. And at that appointment, I don't know if I mentioned in the last video, I still hadn't gained any weight. I thought I had gained a pound, and then turns out I hadn't. So that was at, 21 weeks. Yeah, it's crazy. So that's great. I think that's great. My doctors, I think, would tell me if it wasn't great yet. Today, currently, I am 22 weeks and 4 days. Monday, Tuesday, Wednesday, Thursday. Yeah, 4 days. So, again, it's just in the middle of the week. So, 22 weeks and 4 days. So I could have gained weight since that appointment, because it's been, just a week and a half now. And according to the What to Expect app, it says that this is when the baby's really going to start packing on some weight, after about 23 weeks. So, then I will start gaining weight, I assume. my diet has been basically the same. I really like fruit, are my snacks, fruit, almonds, um, granola bars, but trying to stick with that same thing. And not mozzarella sticks, string cheese, which I think is mozzarella actually, but, yeah, so string cheese, cause the dietitian that I had spoken to back weeks, feels like a lifetime ago, had said that that's a good, healthy way to get my calcium and, it's low calorie because they're light mozzarella sticks or cheese sticks, whatever. You guys know what I'm saying. And so yeah, and I still can't meat sometimes. Just if I have meat, I'll really want it, and then I'll only have a little bit, and I'll be done. Or just generally want to avoid it. We ordered pizza a couple weeks ago, and I just I don't want meat on my pizza, and so it's just meat's been hard. But I heard that that's common. The texture, the flavor, just that. And I still can't have anything smoked. No barbecue. Brian can't even work the barbecue because if he comes in smelling like barbecue, it makes me gag a little. So, we had the big ultrasound where we found out that Sawyer looks like Sawyer's totally healthy and is going to make it. And so we haven't had another OB appointment since then. We left that appointment, and they were going to figure out amongst my team of doctors, the OB, the perinatologist, my genetic counselor, and the other perinatologist that we had seen for the specialist in Oakland, we're all going to decide who is going to handle my primary care for the rest of the pregnancy. And so they did decide on the perinatologist locally, at my local hospital. Will be seeing me every 2 weeks, at least for now. I assume that that's the plan until, I don't know if it's for the rest of my pregnancy or just until we're sure we're out of the woods. I really don't know. And you know what, honestly, I don't think they know. So I very well could be seeing a perinatologist for the remainder of my pregnancy, because we're still considered high risk. Just because we had those scans, we're going to be considered high risk for the rest of it. So we'll see. I'll let you know if they let me know. But also, the appointments. So yeah, we told you guys that the doctor, that we saw in Oakland, the perinatologist there, she said that they do not have any further cause for concern. Their only point of concern was, again, the lack of the nasal bone, and the fact that they really couldn't get good, clear pictures of Sawyer's heart. He was being very difficult, curled just the wrong way for them, and that no matter what we did, they couldn't get him to move, and so we can't 100% count out a heart defect as the problem. So she said she's not concerned. Everything else is pointing to a very healthy baby, very healthy pregnancy. But they wanted to make sure. And so they did finally schedule me an appointment with a pediatric cardiologist. So he works with all children, obviously, starting in the womb. So when we went there, when we went to the appointment, luckily they got me in. He spent some time in my local facility, so my local hospital, which was great. We would have gone anywhere in the Bay Area that we needed to make sure that the baby's okay. But it was still nice to be accommodated at the local facility. And then when we were there, we weren't in the waiting room for very long, and then the nurse brought us back, and she said that the doctor we were actually seeing was actually one of the leading pediatric cardiologists in all of Northern California. So, or the leading, one of the leading or the leading, I don't know, but either way, it sounded very impressive, and she sounded really impressed. I guess she was trying to learn from him, and he was trying to take her under his wing or whatever. But yeah, when you hear that, you're like, yes, thank you, bring it on. So that was great. Hearing that he was, he'd been doing his job for 16 years and he was considered one of the best. So, if there's anyone who's going to look at my baby, then, that's the guy to look at. But, Yeah, so we're just laying on the cot, and let me tell you guys, that was the longest hour of my life. Oh my gosh, longest hour of my life. I was so uncomfortable, and I don't know if it's because I'm just getting bigger or, it was just, my comfort level went from, okay, this is a normal ultrasound, to a half an hour went by, and I'm like, okay, I'm really starting to get uncomfortable, to 45 minutes where I'm like, oh my gosh, I'm gonna cry. I'm gonna cry if I have to lay here for another minute longer. And he kept asking me, do you need a break or anything? I'm like, no, can we just get this done? I just want you to have the pictures. Just want you to get the pictures that you need. But basically what we learned from that appointment, he busted out, the little model of the heart and stuff like that. And so I thought, the worst, because they don't really say anything during, he's like, well, it looks fine, but, he doesn't go into much more detail during, which the nurse warned us that he wouldn't. She said he is not much of a talker. He really goes over it with you at the end. So, I wasn't expecting much, and I was just so happy not to be laying down on the stupid cot anymore. He basically said that he can't find anything. He said that the things that he cannot see, because there's multiple factors why he couldn't get great images in general, but he said from the things that he can't see, he looks at secondary things that would have a problem, that would indicate the first things that he couldn't see. I hope that makes sense. So he couldn't see the first things, but he looks at secondary things that to see if there's anything wrong with those, which could indicate something wrong with the first things that he can't see. And he said all the secondary things look fine. So from what we know, the baby has 4 good chambers. The blood is flowing in like it should, out like it should, to the lungs and back from the lungs, to the upper part of the body and lower part of the bodies and back, just like it should. But because Sawyer was once again being difficult with his positioning and not interested in moving for them at all, and the fact that my placenta is anterior and it's just really hard for them to apparently get images through that and around that. And on top of the fact that, Sawyer's heart's the size of a dime at this stage, according to the cardiologist. So really, with all of those limitations, it's great that they can see as much as they can, but so they can't with 100% certainty say that there's absolutely nothing wrong with his heart. But he said that there is nothing from what he can see, and he took 1,000 images, there's nothing that he can see that would indicate a fetal problem right now, a cardiac, help me out with the words, guys. But yeah, a cardiac, there we go. It came to me, a cardiac problem right now while I'm pregnant. He said that when I give birth and Sawyer is born, they, all babies are assessed to make sure that they're healthy and their hearts sound fine. So he'll be assessed, but it'll be in our file that that there's this question. So he will be, specifically looked at for that, and that if they have any questions or worries, they will either move him to another facility, or like a specialist facility with a special NICU with a special cardiology department and stuff, or they might just decide if he sounds fine, looks fine when he's born, we'll just get we'll be able to leave the hospital like normal, like any other pregnancy or birth, and then a few weeks later, within the first few weeks of his life, bring him back for an echocardiogram on his heart, just to completely verify that there really isn't anything. So he said that that's probably what they'll want to do. So that's great. Right now, to the best of medical professions' opinions, Sawyer's fine. His heart is good. He is growing, and we're not indicating, nobody's worried. So I'm just gonna go with that. Through all the crap that we've dealt with, I have to stick with the positive attitude that I've tried to have throughout this whole thing, and just say, all the doctors think he's fine. So you know what? I'm gonna just try to think he's fine and just prepare for that. So I'm just going to try to really enjoy the rest of this pregnancy. But I do have to admit that when the nurse is, setting me up and laying me down and putting, putting the towel over your jeans and stuff, I started crying, but not like weeping, but like a few tears, like, oh my God, I hate doing this. I hate them. I hate ultrasounds, and they should be these fun things, and you get to see your baby. But it's just, there's so much stress and pressure, and I hope he's okay, and this will be the one where, there'll be a problem, and, it's hard. It's just when you're laying there, it's just the panic sets in, and you're like, the other shoe's gonna drop now. So I really have to tell myself, I'm going to be having a lot of ultrasounds during this pregnancy. There's going to be a lot of doctor's visits, and I really have to try to let go of that fear. And I think over the next coming months, hopefully I will, every appointment that he is doing fine and not going backwards and just getting better, is, another bonus. So yeah, so that's what I'm going to try to do, and power of positive thinking and prayer, apparently. So, yeah. So yeah, cardiologist thinks baby's fine. I feel fine. It's really hard to sit at work. I'm fine most of the day, and then right around 2:15, my body is like, you're done sitting in this chair, because I work at a desk job the majority of the time, and I just... there's only so much time you can spend in a swivel chair before you feel like you want to just run around the room or something. So we're trying out different chairs in the office, and my boss and everyone's being really great and really trying to, help me be comfortable. I've brought in a pillow to prop up against my back so I don't have to lean back as far for comfort. And yeah, so, it's all about staying comfortable. As much as you can in your job. Luckily, I do work at a desk job most of the time, so just trying to make that work. But yeah, so that's all that I have for you guys. Today's Thursday, and I'll post it tomorrow, this video tomorrow, and then I have my first OB appointment with my perinatologist here locally. But it'll just be a regular prenatal appointment, I assume, and a quick ultrasound. I'm not even really sure what my care with him is going to be, and I will ask him, and so then I'll be able to inform you guys later at the end of next week, what the plan is. So, yeah. We still haven't bought any baby things, because I really think that we're just not at that stage yet. It's still new. We still haven't had this information for 2 full weeks yet. So, yeah, but it's just crazy. Just crazy. My life has been crazy. Yeah, but anyway, so I'll let you guys go. And I will be talking to you. Me and baby Sawyer will be talking to you after our next ultrasound. Okay, bye.